With things continuing to change across the basin and across the state, we here at Big 2 News are working round the clock to keep you updated. And to help us do that, Texas Governor Greg Abbott joins us live right now. Good evening, Governor.
Good evening. Great to be with you. Thanks.
Well, Governor, you have left it up to individual counties to shelter in place. Many other governors have ordered complete lockdowns across their states to prevent the spread of coronavirus. Why have you decided not to do that?
Well, let me bring you up to date. It was actually last week I issued a statewide executive order requiring people to stay at home. It aligns with the other statewide orders that you see across the United States of America that everybody stay at home. When I say statewide, that means it applies in Midland and Odessa as well as across to all 254 counties. So Texas is doing its part to make sure that people stay at home during this time period, because our job for every community is to make sure that we slow the spread of the coronavirus. The good news is I talked to Dr. Deborah Birx, the doctor that you see on TV along with the president, and she's saying that the strategies that Texas is undertaking is doing a good job in our mitigation efforts. But if we let up now, everything that we've done so far will be for naught. We need to continue with these statewide mandates. And understand this, there are consequences for people who fail to comply with the statewide mandate. But I appreciate everything being done by the great people of the Permian Basin across Ector and Midland County to follow this executive order that I issued last week.
Well, Governor, yesterday you told us that the drug hydroxychloroquine is being tested here in Texas. The president continues to encourage terminally ill patients to take the drug, and he said, quote, it's up to you, but what do you have to lose, end quote. Do you agree with this advice?
Well, what I do is I depend upon doctors to make decisions about what they prescribe to patients. What is being done in the state of Texas is not anything being done by government. What's being done in Texas is exactly what's being done elsewhere, and that is doctors consult with patients before they administer a drug, just like they do in every case whenever they administer a drug. This has been undertaken for several days now at a location in Galveston County. We'll find out later on this week if it's working. There have been countless examples already articulated by people across the country as well as across the world that it has proven to be positive. If this is an effective treatment that can be administered by doctors, then patients should have access to it.
Well, Governor, yesterday you gave us some good news. You told us that medical supplies are on the way for the state, including personal protective equipment. But with a possible surge still on the way, how long do you think these supplies will last?
The supplies are bountiful right now. We are providing this week alone is about 5 million of these masks that are needed to be worn, as well as about 200,000 face shields, more than 2.7 million gloves, and more than 170,000 gowns. But I'm going to be making an announcement tomorrow talking about how profound our future capabilities are to make sure that all of these hospitals and doctors and nurses and first responders are going to have the PPE equipment that they need to be able to deal with the coronavirus in Texas.
All right, we look forward to that, Governor, and thank you so much for joining us. We appreciate you always being accessible to the media, including us right here in West Texas.
We'll stay in touch with you. God bless Midland, Odessa.
Thank you, Governor. And remember, you can always stay up to date on the latest executive orders from the governor and guidelines for Texas at our website, yourbasin.com.
Now.